Dana, thank you for coming today.
Hello.
How are you doing?
I'm good today.
Good. So what we're going to do today is your first assessment. So I'm going to take your blood pressure and manual heart rate. So I'm just going to ask you to stay nice and still. So your back, are you comfortable in your chair? Your back is up, feet are flat.
Yeah.
And I'm just going to get you to leave your arm like that. And we're going to have you sit like that nice and quiet for 5 minutes. Okay, so during this 5 minutes, I will just explain to you the procedures that I'm going to do. So initially, I had you fill out this informed consent form, and what this form, what you consented to was me being able to do some of these tests. So for example, your blood pressure and your heart rate today, as well as some body measurements and some tests to measure physical fitness.
Okay.
Now, the results of these tests are going to be used to design a program that is specific for you, so based on our last meeting and consultation. So all the information I gathered from today, as well as from our consultation, will be put together. So it also outlines that there can be some risks to your physical activity and that you are aware of that too. So, and also if you are experiencing any symptoms, like during a workout, or if things change, to let me know so I can adapt your program, as well as to keep your doctor informed. So, you have signed it, but do you have any questions regarding the consent to the physical assessments?
What kind of symptoms do you mean?
Well, like if you're experiencing dizziness or like chest palpitations or like things of that nature.
Okay.
So just to keep me informed. So comfortable with that?
Yes.
All right. So speaking just about your health questionnaire, so I also had you fill out the Part Q where you assessed your current health status, and you had no conditions that were of concern except for question 4 and 5 where you talk about medical conditions and the medications that you're on. And I did do some research about the medication, and it exercise is not contraindicated, but just to be aware of feeling dizziness or low blood pressure or low blood sugar. So symptoms that you're probably aware of. Has your doctor gone over side effects of your medications?
Not those kind.
But do you know to be aware of it?
Not really.
Okay. Can I assume that those haven't been an issue for you
No,
in the past?
I don't believe there's any concerns.
Okay.
Yeah.
Okay. Well, that's good. But of course, if things change, just to let me know.
Okay.
And important, the last question, you have been cleared for physical activity.
Yes.
So that's good. So I'm going to talk about the assessments I'm doing today. So once the 5 minutes is up, I'm going to take your radial blood pressure and I'm going to count that for 15 seconds. So I'm just going to palpate just above your wrist. Is it okay for me to touch you?
Yes.
Okay, so I'm going to look for your radial blood pressure somewhere in this area. And I'm going to record that for 15 seconds, and if that value is above 99 beats per minute, I'm going to have you sit quietly for another 5 minutes. We will redo the test, and if it is still above 99, then we're going to stop testing, and I'm going to send you to your doctor.
Okay.
And then I'm going to do your manual blood pressure, and so I'm going to look for your brachial artery, which is located just a couple inches from your elbow joint underneath your biceps. So again, I'm going to get in there with my fingers.
Okay.
And I'm going to landmark that with the blood pressure cuff here. So you can see there's that line here. So I'm going to match it up. I'm going to inflate the cuff to about 20 millimeters above what your blood pressure, your top number blood pressure would be, your systolic, while I'm listening to your radial pulse. So once that disappears, I'm going to increase it.
Okay.
20 more millimeters. Then I'm going to take the end of the stethoscope, put it under the cuff in that, about where your brachial artery is, and I'm going to listen to the changes in your heartbeat. So once I can hear your heartbeat again, that is your systolic, so I'm going to record that number, and then I'm going to I'm going to release the pressure, about 2 millimeters or so per second, listen for when it changes, the sound changes, it becomes a little more muffled, and that's your diastolic pressure.
Okay.
And then I'll release the cuff, so less pressure on your arm, and if the top number, I believe, is over 144, or the bottom number is above 94, both numbers if they're above, then we're going to repeat, so we'll sit quietly for 5 minutes, we'll repeat it, and if we get the same results, then I'm going to send you to your doctor. Are you comfortable with everything I'm going to do today?
Yes, it sounds perfect.
Perfect, and we are at our 5 minutes, so I'm just going to reset the timer. I'm going to locate your radial pulse. All right, I'm going to start counting now. Stopping. So we're at 17 over 15 seconds, which gives you a resting heart rate of 68. So we are good to proceed with the next test. All right, so I'm just going to find that brachial artery. I apologize if my hands are a bit cold. All right, so I have located it, just lifting your bicep just right in there. So I'm going to put the blood pressure cuff on your arm. I'm going to line up right there. And bring this up. How's that, good and snug?
Yeah.
All right. Okay, stethoscope on. Okay, ready?
Yeah.
There we go. Make sure it's closed. Okay, so disappearance of the pulse. Okay. Sorry if this is a little awkward. Okay, I'm going to slowly release. Okay, we've got 108. Muffled at about 72. So 108 over 72. And release that. So, healthy blood pressure, we're good to proceed.
Awesome.
Okay. Thanks, Dana.
Thank you.